Hi everyone, welcome back to my YouTube channel. Today we are going to talk about Maxilla. We will start our topic with introduction, and here you can see the picture of skull, and the green portion is the maxilla. Maxilla is one of the most important bones in human skull, forming the upper jaw and contributing to the structure of face. It plays a crucial role in supporting the teeth, forming parts of nasal cavity and orbits, and assisting in speech and mastication. Maxilla is a paired bone, meaning there are two maxillary bones, one on each side of the face, that fuses at the midline to create a solid structure. Understanding its anatomy is essential in medical, dental, and forensic sciences. Now let's talk about the location of maxilla. Maxilla is located in the mid-face and serves as a central component in the craniofacial skeleton. It articulates with the several bones including frontal bone, zygomatic bone, nasal bone, palatine bone, and sphenoid bone, ensuring stability and connectivity within the skull. Now let's talk about the structure of maxillary bone. Maxilla consists of multiple sections, each contributing to the different functions. The first structure part includes body of the maxilla, that is the main central portion housing the maxillary air sinuses. The second part of the maxilla is alveolar process, that is a section of the maxilla that contains sockets for upper teeth. The third part is palatine process that forms the anterior part of hard palate and it separates the nasal cavity from the oral cavity. The next part of maxilla is frontal process that extends outward to connect with the frontal bone contributing to the facial structure. The next process is zygomatic process that joins with the zygomatic bone assisting in cheek formation, and these components ensure the maxilla structure integrity and functional importance. Now let's talk about the anatomical features of the maxilla. Maxilla contains several distinct anatomical landmarks that serve various physiological functions that are maxillary sinuses, that are basically large air-filled cavities within the body of maxilla playing a role in voice resonance and reducing skull weight. The second anatomical feature of maxilla is infraorbital foramen, that is small opening below the orbit that allows the passage of infraorbital nerve and blood vessel contributing to facial sensation. The third anatomical feature of the maxilla is alveolar ridge, that is the bony ridge that supports the upper teeth ensuring proper alignment and function during chewing. The next anatomical feature is anterior nasal spine, that is a projection at the base of the nasal aperture providing structural support to the nasal cavity. The next anatomical feature of the maxilla includes incisive foramen that is located in the hard palate allowing passage for nerves and vessels supplying the upper jaw. The next feature is orbital fork contribution that as it forms part of the inferior border of the eye socket supporting and protecting the eyeball. These features highlight the maxilla's significance in maintaining facial structure, facilitating sensory function, and supporting respiration. Now let's talk about the function of the maxilla. Maxilla is essential for various physiological processes, including structural support for the face, as it maintains the shape and stability of midbrain, midface, and jaw. The second function of maxilla is attachment for upper teeth, as the alveolar process securely holds the upper teeth, ensuring efficient mastication. The third function of maxilla is facilitation of speech and resonance, as involvement of hard palate assists in sound modulation during speech. The next function is protection and support for the orbit, as it forms part of the orbit floor, ensuring structural integrity of the eye socket. Next function of the maxilla is airway contribution, as maxillary sinus participate in humidifying and filtering inhaled air. So each function contributes to overall mechanical and physiological roles of maxilla in human anatomy. Now let's talk about the clinical significance of maxilla. Maxilla is subject to various medical and dental concerns. These include medical maxillary fracture, that are trauma that can cause fracture affecting facial symmetry, sinus function, and dental alignment. The next clinical significance is cleft palate. That is a congenital condition in which the palatine process fails to fuse properly, leading to oral and speech difficulties. The third significance of maxilla is maxillary sinusitis. As infection or inflammation of maxillary sinuses can cause discomfort, nasal congestion, and respiratory complication. The next significance of maxilla is dental disorders, as issues such as malocclusion, tooth loss, and alveolar bone resorption can impact mastication and facial aesthetics. The next significance is in surgical consideration, as the maxilla is a common site for reconstructive surgery, dental implants, and corrective procedures. Now let's talk about the conclusion of the lecture. Maxilla is a foundational concept component of the skull, essential for facial structure, dental support, and respiratory function. Its complex anatomy makes it a key focus in medical, dental, and surgical fields. Understanding its role in human body provides valuable insight into craniofacial health and clinical applications. So this was all about maxillary bone. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.